Welcome to a brief presentation summarizing the treatment effects of two skills targeted for increase within the Peak Direct Training module. The two concepts selected were 12C, receptively label emotions, and 12P, tact emotions. This was selected for this particular learner as part of their applied behavior analytic treatment plan for several reasons. Number one being the social validity. The parents expressed they considered these skills to have practical value in their everyday life. It was also identified as a deficit during the peak assessment, and given the abundance of peer-reviewed journals correlating an individual's peak scores with increased IQ scores and less severe ASD symptoms, any concepts selected within the peak curriculum would have sound empirical rationale. We were also looking to increase the learner's language repertoire and teach them these skills because it does qualify as a behavioral cusp. It can bring the learner's behavior into contact with new contingencies that have potential far-reaching consequences. So we sought out to show that discrete trial training combined with positive reinforcement would increase the learner's receptive and expressive language repertoire. The participant was one 6-year-old male diagnosed with autism spectrum disorder. We used a multiple baseline design because the target behavior is likely irreversible. It was easy to use, and the threat to internal validity was low. The independent variable was a specific technology adhered to using DTT and differential reinforcement. The dependent variable was for 12C was the receptive identification of 6 emotions, matching what the learner heard to what he saw. And dependent variable for 12P was the expressive identification of 6 emotions, matching what he saw to what he spoke. We used differential reinforcement combined with discrete trial training, in which each response emitted by the learner was immediately consequated with either reinforcement or an error correction procedure. Discrimination training consisted of mass trials, expanded trials, and we established mastery criteria in a random rotation with the learner achieving an aggregate correct response rate of 90% across 2 consecutive days with 2 different people. Most of these prompting strategies were used until the learner met criteria, and then we switched to a no-no prompting strategy. The prompting hierarchy was initially where we presented a full stimulus array using gestural prompts as needed. First, the gesture prompt was presented for the entire duration of the learner's response, and then we faded to a quick 1-second gesture to the correct picture. Then we would fade to an independent opportunity to respond. Physical prompts were not used or required for this particular learner. We also planned for a bit of stimulus generalization embedded within our SD by varying the language, like which one is, show me, find, where, etc. The response criteria was the learner selecting it by touching or picking up the corresponding card. A non-example would be pointing without touching. We wanted to be very clear and objective. Pointing or gesturing to the card could become subjective easily. And the error correction procedure was different for non-responses and discrimination errors. Discrimination errors were given corrective feedback of no and immediately followed by another opportunity to respond with the most recent successful prompt presented simultaneously with the SD. Non-responses were consecrated with feedback. We oriented the learner back to the task and represented the SD without a prompt. So we took a multiple exemplar training approach to teaching receptive emotions. To prepare stimuli, we had 6 sets of photos made with 6 familiar people demonstrating a different emotion in each set. For example, if mom was happy in set 1, she would be sad, silly, scared, angry, surprised, and happy in each of the other sets, respectively. So that way the learner would have 6 potential sets to demonstrate generalization on, and our goal was for them to demonstrate generalization at set 2. It's important to remember when teaching any receptive skills, but especially emotions and things like opposites, in order for the conditional discrimination skills to be under the appropriate stimulus control, the learner must identify the relevant features of the program antecedent stimuli. So we help to control for any erroneous aspect of the instructional environment, controlling the learner's response by taking very strict pictures and adherence to pictures. So If you look at the top line, aside from the poor dramatics, these are all pretty good stimuli selections because there aren't any extraneous or erroneous variables that the learner could pick up on. On the bottom, there are several. Right here, the learner could be attending to the color instead of the fact that the emotions look like the person is happy. They could be attending to Mario in the background over here instead of the emotions for surprise. And even down here, compared to the pictures up top, this one could be a little bit of a prompt because this one shows all the way down to the person's mid-leg instead of their hips like the other picture. We collected baseline for 3 consecutive sessions and the learner demonstrated 0% independence. And we introduced the first targets, happy and sad, from set 1. All remaining targets remained in baseline. Once criterion was met, generalization tests were conducted for happy and sad in the successive sets.